Groundbreaking new response to cardiac arrest, expected to save lives. This is by The Conversation. As of January this year, Aotearoa, New Zealand became just the second country after Canada to adopt a groundbreaking new procedure for patients experiencing cardiac arrest, known as double sequential external defibrillation, DSED. It will change initial emergency response strategies and potentially improve survival rates for some patients. Surviving cardiac arrest hinges crucially on effective resuscitation. When the heart is working normally, electrical pulses travel through its muscular walls, creating regular coordinated contractions. But if normal electrical rhythms are disrupted, heartbeats can become uncoordinated and ineffective or cease entirely, leading to a cardiac arrest. Defibrillation is a cornerstone resuscitation method. It gives the heart a powerful electric shock to terminate the abnormal electric activity. This allows the heart to reestablish its regular rhythm. Its success hinges on the underlying dysfunctional heart rhythm and the proper positioning of the defibrillation pads that deliver the shock. The new procedure will provide a second option when standard positioning is not effective. Using two defibrillators. During standard defibrillation, one pad is placed on the right side of the chest just below the collarbone. The second pad is placed below the left armpit. Shocks are given every 2 minutes. Early defibrillation can dramatically improve the likelihood of surviving a cardiac arrest. However, around 20% of the patients whose cardiac arrest is caused by ventricular fibrillation or pulseless ventricular tachycardia do not respond to standard defibrillation approach. Both conditions are characterized by abnormal activity in the heart ventricles. DSED is a novel method that provides rapid sequential shocks to the heart using two defibrillators. The pads are attached in two different locations, one on the front and side of the chest, the other on the front and the back. The single operator activates the defibrillators in sequence, with one hand moving from the first to the second, according to the recent randomized trial in Canada. This approach could more than double the chances of survival for patients with ventricular fibrillation or pulseless ventricular tachycardia who are not responding to standard shocks. The second shock is thought to improve the chances of eliminating persistent abnormal electric activity. It delivers more energy to the heart, traveling along a different pathway closer to the heart's left ventricle. Evidence of success. New Zealand ambulance data from 2020 to 2023 identified about 1,390 people who could potentially benefit from novel defibrillation methods, and this group has a current survival rate of only 14%. Recognizing the potential for DSED to dramatically improve survival for these patients, the National Ambulance Sector Clinical Working Group updated the clinical procedures and guidelines for emergency medical services personnel. The guidelines now specify that if the ventricular fibrillation or pulseless ventricular tachycardia persist after two shocks with standard defibrillation, the DSED method should be administered. Two defibrillators need to be available, and staff must be trained in the new approach. Though the existing evidence for DSED is compelling, until recently it was based on theory and a small number of potentially biased observational studies. The Canadian trial was the first to be directly compared DSED to standard treatment. From a total of 261 patients, 30.4% treated with this strategy survived, compared to 13.3% when standard resuscitation protocols were followed. The design of the trial minimized the risk of other factors confounding results. It provides confidence and survival improvements were due to the defibrillation approach and not regional differences in resources and training. The study also corroborates and builds on existing theoretical and clinical scientific evidence, as the trial was stopped early due to COVID-19 pandemic. However, the researchers could recruit fewer than half of the numbers planned for the study. Despite these and other limitations, the international group of experts that advises on best practices for resuscitation updated its recommendations in 2023 in response to the trial results. It suggested with caution that emergency medical services consider DSCD for patients with ventricular fibrillation or pulseless ventricular tachycardia who are not responding to standard treatment. Training and implementation. Although the evidence is still emerging, implementation of DSCD by emergency services in New Zealand has implications beyond the care of patients nationally. It's also a key step in advancing knowledge about optimal resuscitation strategies globally. There are always concerns when translating an intervention from a controlled research environment to the relative disorder of the real world, but the balance of evidence was carefully considered before making the decision to change procedures for a group of patients who have a low likelihood of survival with current treatment. Before using DESD, emergency medical personnel undergo mandatory education, simulation and training. Implementation is closely monitored to determine its impact. Hospitals and emergency departments have been informed of the protocol changes and been given opportunities to ask questions and give feedback. As part of the implementation, the St. John Ambulance Service will perform case reviews in addition to wider monitoring to ensure patient safety is prioritized. Ultimately, those involved are optimistic this change to cardiac arrest management in New Zealand will have a positive impact on survival for affected patients. This was from the conversation here under Creative Commons. This is by Vinuli with Anar Archie, PhD candidate, College of Health, Massey University, Bridget Dicker, Associate Professor of Paramedicine, Auckland University of Technology, and Sarah Messon, Research Associate, Auckland University of Technology, on Science Alert. Please leave your comments and thank you for your support. Kindly support my Patreon account. The daily posts are 5 videos daily, and they are totally different from what I have on my YouTube channel. Thank you so much for your support and that you find all my content so interesting. You'll find the Patreon account details in the description box below.